Take Back Your Health Now, Episode 86. Information contained in this podcast is not medical advice. It is for educational and informational purposes only. Please consult with your doctor before making any health choices.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
Hi, this is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. Today we're going to be talking about vascular health, vascular fitness, vascular disease, and coronary artery disease. We're excited. We have two guests. So unlike most of our shows where we do one, we get 2 for 1 today. We have Dr. Gary Mezo. He has practiced family medicine, emergency medicine for 28 years, then retired from clinical medicine to dedicate his life efforts to medically, scientifically proving the efficacy and science behind his discoveries. He has been a full-time medical scientist for over 19 years and has enjoyed great success in his research efforts with top researchers at NASA, Mayo Clinic, Cleveland Clinic, and scores of university research centers worldwide. His goal has always been to reverse many chronic disease states by restoring optimal form and function, eliminating the underlying causes, and through marked improvement of system-wide health. He is an expert in Nano Bacteria and endovascular research. And we also have Dr. Ray Strand, MD, has been involved in a private family practice for over 40 years. Over the past 20 years, he has focused his medical practice on preventative and nutritional medicine. He has written and published 5 different books. His book, What Your Doctor Doesn't Know About Nutritional Medicine May Be Killing You, has now been translated into over 30 different languages. He travels and speaks throughout the world, educating individuals about the health benefits of taking high-quality nutritional supplements. Doctors, welcome to the show.
Well, glad to be with you.
Thank you.
We're very excited to have you both on. So, Dr. Mezo, let's start with you a little bit. Just give us a little bit about your background. You do even nanobacterial research. What is that?
Well, that's a whole other subject that's actually quite large.
Okay.
But let's just suffice to say that my researchers actually discovered a nano-sized bacterium that they initially called nanobacteria. And there's a debate as to whether it meets the criteria for living or not living. But it is infectious. It does cause human ailments and diseases. It's responsible for pathological calcification. It's responsible for inflammatory responses in our vascular tree and tissues. We have no innate defense against it, but my formula has been shown to eradicate its damage and its actual presence. So that's a big deal.
Wow. Now, so when you talk about nanobacterial, is this something that's very well known or not that much so?
Well, they were actually discovered in the mid-'80s by a Finnish researcher, Dr. Olavi Kajander. And there have been scores and hundreds, actually, of papers written about nanobacteria and their involvement in human and mammalian pathology. It's esoterically known in the infectious disease community, particularly with involvement with vascular calcification, kidney stones, brain sand, pineal calcification, prostatic calcification. It's been shown to be involved in all of those entities, as well as polycystic kidney disease and many other problems.
Amazing. I had never heard of it. So this is really, to me, this is so fascinating. I know we're talking here, we're going to get into a little bit on vascular disease and vascular health and stuff, but you're saying that part of vascular disease can actually be caused by a nano or very small bacteria that people are not necessarily very much aware of. Is that correct?
Yes. They're from 25 to 200 nanometers in size. And so regular clinical microscopes were not able to detect their presence ever until they were discovered under an electron microscope. And that's what has to be used to observe them. Additionally, their growth rate is such that, it takes about 3 to 4 months to get a culture of them. And so standard clinical culturing methodologies, which, they check 7 to 10 days for most normal bacterial cultures, you wouldn't be able to detect them that way either. So their presence was largely overlooked because they didn't look deep enough.
Unbelievable. And how did you get involved in this? How did this become your life's work, if you would?
Well, it's kind of interesting, and let's just say that I had developed my formula to reverse my own coronary artery disease, and the way that I was able to observe it going away was I had a baseline coronary artery calcification score done and showed that I had pathological calcification in my coronary arteries. And with a strong family history of coronary artery disease and early death for my grandfather and my father, I was motivated, so to say.
Yeah, I mean, okay, I got you. So
try to do something. And one evening I was reading an obscure paper about some Finnish doctor by Kijander who had found this nanobacteria and discovered it and had done a lot of studies and work on it. And so eventually I ended up buying their company in Kuopio, Finland, and we became, I incorporated their company into mine, and we became co-researchers on atherosclerosis and the diseases that nanobacteria can cause, and into proving and showing clinically in clinical trials that my formula was able to eradicate not just the damage and the pathological calcification from the nanobacteria, but it also eradicate the nanobacteria themselves.
Unbelievable. I've interviewed Dr. Stephen Gundry. He's head of cardiovascular surgery, I think, at Loma Linda Hospital. And he was talking about some reversal of atherosclerosis through also diet and, dietary changes and stuff like that. Had you also looked into that arena, or how does that affect this whole concept?
Well, let's just say that the nanobacteria are not affected by diet one way or another, positively or negatively. Their food stuff is HDL and VLDL and LDL, and they actually oxidize these lipids as part of their food stuff.
Dr. Mezo, just for the audience, what HDL, LDL, just go over what those are, if you would.
Well, they're cholesterol, and everybody's heard about cholesterol, and they've heard that the big cholesterol, HDL, is actually good for you, and that the LDL, low-density lipoprotein, and VLDL, which is very low-density lipoprotein, are bad for you.
Right.
And so cholesterol theory of atherogenesis, or plaque buildup, has been shown in many studies recently over the last several years to be maybe not so true. So there are benefits to behaving yourself with a proper diet, but it's our understanding from our research and our work that the dietary problems that people may or may not have nothing whatsoever to do with being afflicted or disturbed or made sick or impaired by nanobacteria. They're mutually exclusive things.
Wow. This is groundbreaking work. Now, obviously, you had, I don't mean to put this in a way, but you had a death sentence over your head. You found this material, you found this company, and you were so impressed by it, you actually bought the company.
Yeah.
So clearly this was there a point of total, you started looking at it and you almost fell off the chair? Or how did you?
When I was reading their study, early in the morning, and I stumbled upon it. I read their entire paper, and I did some more research. And for me, it was like, oh my goodness, I'm already treating what they discovered. And
Wow.
so I called them the next day, and well, they thought I was probably nuts at first. I said, well, how could you be doing that? We just discovered this and have been doing basic science work and microbiological documentation of the pathogen, and you're already treating it. I said, yeah, cool, huh?
Wow. No
Within a
kidding.
couple of weeks, I was in Finland, and we started our talks over a period of about 10 days, and then we decided to collaborate. And then I ultimately bought their company and used their research facilities in Finland as my bench science place and research center.
What a story. You should write a book about this. This is, or maybe you have, because
Well, there have been a couple of books written about us. One of them was Has Heart Disease Been Cured? By Doug Mulhall and Katja Hansen. The FDA did not care for that particular title.
okay.
So they rewrote the book and called it The Calcium Bomb. And it's out of print, but it's still available on Amazon. And a lot of people have read it.
Wow. Dr. Mezo, let me ask you, there was a story about, I guess, NASA and the nanobacteria in astronauts. Could you talk about that a little bit? Is it true that astronauts actually have like 5 times the increased rate in heart disease because these nanobacteria grow in lacking in times where there's no gravity? Am I saying that right?
Well, we did. Actually, one of my researchers I put at NASA Johnson Space Center under a Space Act agreement for 7 years. So we had a nanobacterial research center inside of NASA microbiology division. And one of the things that, NASA thought was pretty interesting, and, they have their astrobiology institute that they run there as well. And so they were very, very interested because it's been known for a while that, astronauts suffer from certain types of conditions. And one of them is increased rate of atherosclerosis, pathological calcification, kidney stones, heart disease. And so we sent some nanobacterial cultures up into the space station, and we did some things with that. And we were able to determine that nanobacteria actually grow about 4 or 5 times faster in zero gravity than they do at standard gravity on Earth. And so that was a pretty plain kind of a finding. It made sense, and it was true. So
Wow.
they were very, very interested, to say the least.
Wow, that is fascinating.
So a lot of astronauts get a CAC, or coronary calcification score, done before they go up into space, and they repeat that when they come back.
And what do they find? Does it markedly increase?
Yes.
Wow. Is there these nanobacteria, are they part of our normal flora? Is there some positive function that they have, or is this completely a disease state?
Well, let's just say that they've been around from what we believe billions of years, and they're probably ancestral observers of our existence here. And so we grew up with them, and they're found in clouds, seeding clouds. They're in our water systems. They're in our plants. They're in our animals and our mammals, and they're everywhere. But
Wow.
they grow slowly, and they replicate upon themselves at the rate of 35 to 55% a year in calcification. Uncalcified is faster than that, but they do not provide us with any benefits.
Okay.
They're detrimental. They do cause RNA and DNA replication errors, which means they could actually stimulate or be a nidus for a cancer. There's been several studies with nanobacteria and breast cancer, nanobacteria and ovarian cancers. And in fact, in the medical world and radiology, whenever you see pathological calcification that's extravascular, they start looking for cancer. So I don't know if it's a chicken and an egg thing or if they're just innocent bystanders. They happen to get stuck by cancers, or they stimulated the problem to begin with.
Unbelievable. Are there antibiotics that actually can kill these nanobacteria? Are they resistant to them?
Well, most antibiotics cannot kill them. Not at human tolerable serum levels. So it would take a ridiculous amount. They're tough bugs. They're resistant to 100 megarads of gamma radiation. They're resistant to acids, base. They're resistant to most all antibiotics. They do have sensitivity to some antibiotics, but the problem is nanobacteria are not always just free-floating in our serum and in our tissues. They're calcified. So the first thing you have to do is uncalcify them before you would actually try to kill them. And so,
this reminds me of like Lyme disease. I've read on Lyme disease where they actually crystallize themselves, the bacteria, to surround themselves so you can't actually penetrate them. Is it sort of a similar concept?
The endpoint maybe, but the pathophysiology is completely different.
Okay.
One, with Lyme disease, the Lyme spirochete can become encysted, and that's because the body would isolate it and wall it off like an area of infection, like a cyst, and isolate it, kind of like TB also. You'll find calcified nodes in TB. Nanobacteria do it in a different way on their own. So different pathology.
Gotcha. Different pathology, maybe the same concept in terms of result. Well, let me ask you, Dr. Strand, to bring you on board. So how did you become involved with Dr. Mezo? How do you sort of fit into the picture, if you would?
Well, I've been practicing nutritional and preventive medicine for 20 years, and of course, I've been studying the health benefits my patients could receive by taking high-quality nutritional supplements. And of course, I promote healthy lifestyles, diet and exercise. And I'm a physician who I'm not afraid of medication, but I like to use it as a last choice, not a first resort, and give my patients a trial of healthy lifestyles and treating many of the diseases we run into. And so I have been involved with very reputable nutritional supplement companies. I've spoken all over the world for them. And the company I'm presently with acquired the formula that Dr. Mezo had developed. And of course, I'm new to the game, but obviously I see your interest. I've got the same interest. I love listening to Dr. Mezo and where we are because of my personal observations. So I am now studying, going back and researching. I like to have my own experience. I've got right now probably 25 of my patients taking the formula, some in all various different stages of disease and trying to improve vascular health. But so I don't have the vast experience that Dr. Mezo has with this product or the understanding. But that being said, we know what we're doing in medicine today is not helping our patients.
Yeah.
And I think that's kind of your whole basis of this podcast and reaching out. Is there some other approach? And that's kind of what happens to the physicians. In my stage, I was a typical physician for half my medical career. And now I've realized that I was just drug oriented, disease oriented, and I knew my medications. And but I was not preventing anything. All I was a disease care expert. Now I want to try. Yeah, go ahead.
Actually, I mean, exactly what you're saying. I'm a podiatrist. The reason I started the show is I'm getting asked questions on different disease states that I'm not qualified to answer, honestly. And I'm like, well, just go back and ask your medical doctor. And they would go back and they would come back with the same questions. And after years of this, I finally said, let me take full responsibility and let me just put together the experts in different areas, and I'll present it to people and they can make their own decisions. So I'm on board with you. I'm actually, we're very much thinking in the same direction. But let me ask, so it's going to this coronary artery disease. How would somebody know that they had coronary artery disease? How would they know that they had some sort of a vascular insufficiency or inefficiency?
Well, that's the basic problem. Number one is that when your arteries begin to age and harden and getting soft and hard plaque, it is silent. You don't feel it. How does it feel when your arteries get hard? You don't. Right. The problem is over half the time, the first sign of heart disease is either sudden death or a heart attack. And of course, that's the dilemma. And of course, what happens? They grab their chest. If they're fortunate to make it to the hospital, a cardiologist more than willing to do a coronary catheterization, put in a stent if that's not appropriate, to do bypass surgery. And that's medicine. Acute care at the very end of a long progression, a decade's progression of a disease. So that is where I had been doing these heart calcification scores for the last 20 years on my patients, because I wanted to find people who had heart disease before they were in, the coronary care unit or in an ER. The problem is, once you find that they had coronary calcium, there was nothing I or anybody could do. Sure, we would get more intensive lifestyles. I wrote a book called Death by Prescription. It was very successful. It's been translated a lot of different countries and languages, but the thing is, it's real obvious that the medical information, the medical science in this country is totally controlled by the FDA and Big Pharma. And so they control anything that we do, but it became very obvious to me that heart disease is not a disease of too much cholesterol building up in your bloodstream or in your vessels. It's, if you look at the medical literature, it's an inflammatory disease. But now that I've met Dr. Mezo and I'm getting experience with his formula, I'm starting to realize, what if we've been on the wrong track all of these years, and people who are trying to do everything according to the medical community and still finding out they have serious coronary artery disease, that it didn't work, we've done them an injustice. And so I'm looking at this very carefully, and so far I've been very impressed, not only with Dr. Mezo and the research and the other individual physicians that have had more experience with this product, but I'm excited of the fact that we may be able to help a tremendous number of people that were not previously helped.
Understood. Dr. Mezo, let me ask, going back to you, Dr. Mezo, sir, we talked about bacteria not particularly being able to attack these nanobacteria, and yet clearly you were bent on figuring out how to kill them off, how to cure this to some degrees, or kill these nanobacteria. And it sounds like you developed a formula. Just go into that a little bit. How did you develop this? What kind of results? Just go into that aspect, if you would.
Well, this is a long story. But suffice it to say, once I had found out that my coronary calcium score was 732 and I was extremely high risk for having heart disease.
What would be what's normal? What would be a normal score?
0.
Oh my God. Okay.
All right. So anything over 100 is risky, and absolutely anything over 100 in the left anterior descending coronary artery puts you at the highest risk. So I was total score highest risk and LAD highest risk, and so anyway,
what is LAD?
Left anterior descending coronary artery.
So you basically have a gun to your head while you're trying to figure this out.
Well, I didn't think I was going to get to live very long. I was running around, Mach 5 with my hair on fire, trying to live life in its absolute fullest. And I even hated to sleep because it was a waste of time.
Wow.
I was in for the rapid race. But at any rate, I was able to figure out the formula, and I wrote it down. I had it compounded and I had it made, and I started taking it myself. And I started feeling, more energetic and better. Let's just lack of different terms. Lots of things got better. And I repeated my CAC score after about 6-8 months, and my score was 0, and I was pretty happy about that. So
your score went to 0 from 732. It went all the way down to 0.
Yeah. Well, that's not always typical, but in me, that's what it was. And so, there's lots of permutations on vascular plaque. There's plaque that's more dense than others. There's plaque that's broader, wider, deeper, thicker, covered by more amyloid beta content, more soft cell detritus, dead cells, dead leukocytes, soft plaque. And so not everybody's going to respond exactly the same.
Sure.
And that's just the way it is. But at any rate, I responded. Now I know I've responded pretty quickly, and I'm happy about that. But after doing that, I did a study on 92 of my own patients, and the criteria pretty much was that they had to have, stable heart disease. They could have angina and take their nitro, et cetera. I did baseline labs. I did baseline CAC scores, coronary calcification scores, and I treated them all for 4 months, and they all improved. Their anginal chest pain went away usually in about, a week, and absolutely within a month. And there were no side effects, and they all improved and got better, and they felt better. And the average decrease in coronary calcification score of those 92 people was 58.5% decrease in 4 months. And I thought that was great. But now I did not stratify these people. I didn't care if they were young, old, black, white, male, female, doesn't matter. They just had to have a positive CAC score. Okay. And some of their scores were under 100, and some of them were over a couple of thousand. And so, but the fact that the average score decreased was massive. And the fact that it was,
Dr. Mezo, is there anything else in the medical community that would do something equivalent to that?
We've not found it yet.
Wow.
So, it was pretty big deal. And so I realized at that point that I had a really large tiger by the tail, and the possible benefits to mankind and people with heart disease. I needed to be able to prove this outside of my own pilot study. Okay. And so I needed to enlist some cardiologists that were blue bloods, that were skeptics, non-believers, et cetera.
Right.
And I did, and we assembled a really powerfully great crew of cardiologists from different universities and institutions, and radiologists that knew what they were doing on comparing serial CAC scores, and it took a while. It took a couple $1 million, and the study was positive, and it did show that we were actually decreasing CAC scores, and there were no side effects. And so it was a pretty big deal, and I obviously have dedicated myself to that, and disseminating that information globally, and doing it as best I can. We chose initially to use the physician / pharmaceutical rep / type mode. And so we would educate physicians on how it could benefit them in their practice, and where we had seen anecdotal evidence of improvement of corollary events, et cetera. And
what kind of response did you get from your colleagues?
Pardon me?
Or just in turn, I know the physician groups are always somewhat difficult to get any kind of change into, right? They're sort of, to some degree, stuck in their own way. Do you have any resistance from them?
It depends on on what they do for a living. The general family practice, internal medicine physicians usually embrace it and find it wonderful. Cardiologists usually are very large skeptics, and they're slow to bring and educate, get them on board and get them to fully understand the pathophysiology involved in endovascular disease. It's taken a lot of time and effort to talk and meet with some of the world's top endovascular researchers and educating them. We still have a long way to go.
Dr. Mezo, I got to tell you, my hat is off to you because, it's people like yourself that are pioneering these new technologies. That really is the future. I mean, it's very clear to me that a lot of the old guard, if you would, just don't necessarily have the answers. We hope that they do. But people like yourself that are willing to sort of put their necks out and are willing to look in different areas, God bless you, sir. I mean, realistically, people like yourself are the ones that are really going to make the big changes. And I thank you for your efforts and stuff.
Well, I appreciate that. It has been a tough row to hoe.
I can't imagine. I can't imagine.
We're making ingrounds, and the fact that I was able to license my formula to this wonderful company will allow dissemination of information and use to many, many people all over the world. And hopefully they won't have to drop dead from heart disease. They won't have to go get their stents or bypass surgeries. And hopefully we'll do an end run around what we used to know as heart disease.
And then that's the second largest killer in the United States. Am I correct? Cancer is number one?
No,
is that right?
Heart disease is number one. And
heart disease is number one.
Yeah. And it's actually the largest cause of death in women as well.
Wow. Unbelievable. To turn that around. What a great thing to dedicate your lives to. As we come towards the end of the show, I always ask my guests what they feel the holy grail of health would be. And so I'm going to ask each of you separately. So I'll start with you, Dr. Strand. What do you consider the holy grail of health to be?
Well, I think it's relying on your body's natural defenses and supporting them in the best way we can. And I really do believe that people who take care of themselves, eat a healthy diet, exercise modestly, take high-quality supplements, they have a higher quality of life. And I'm not even talking about extension of life, but just, patients they're not as concerned anymore about the years in their life as they are the quality of life in those years. And when we see the aging of people and the diseases they have to suffer with, I've always been a proponent of trying to maintain and protect our health. And of course, we all are looking at the possibility of helping people who have already lost their health and are trying to regain it.
Yes, sir. Yes, sir. Awesome. Dr. Mezo, how about yourself, sir? What would you consider the holy grail of health to be?
Well, I think things that can be embraced that increase health span as well as lifespan are obviously positive ways to go. We've discovered, of course, that nanobacteria are involved in the development of atherosclerosis. Atherosclerosis is the beginning of the hardening of the arteries. It begins at birth, actually in utero, and it continues until people are symptomatic or they have an event, and it affects every tissue head to toe. It's my belief that atherosclerosis is aging, And if you can stop and reverse atherosclerosis, you've done a great thing.
Absolutely. You've fought off the aging process by a long way. Well, wonderful. What we're doing is presenting information to them they may not get anywhere, and you guys have certainly done that. And it really is just an amazing interview. I greatly, greatly appreciate both of you taking the time to be on the show.
It's been a pleasure to be with you.
Thank you, Dr. Dan.
You're very welcome. Have a wonderful day.
If you're interested in Veinesco, the product mentioned on today's podcast, you can get that over at www.veinesco.net/now. That's www.veinesco.net/now.
This episode is sponsored by New Jersey Foot and Ankle Center in Oradell, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time.